Hey folks, Dr. McCarthy here, and I want to welcome you to our Wednesday night workshop. We're going to spend some time tonight talking about a couple of really important things. For those of you that don't know, this is the newest book that we just came out with, the McCarthy Method, Unlock the New You. And in here we talk about the foods you eat and food sensitivity testing and how it relates to all the different areas of your health. Tonight we're going to focus in on one topic that we cover in a lot of depth. It starts on page 12 here in the book. When we're done with the video tonight, I'm going to put up a link to the book so you can get some more information on it. It brings you to our website where it talks in a lot more detail. However, it's just really, it's exciting for me that people are sucking these things up now because they're able to, we just shipped the book off to someone who was in Texas, right?
Yeah.
I think it was Texas, yeah. So it's really cool. Now, this is a guy that probably saw my videos and said, hey, this information makes sense. My doctor doesn't talk about this stuff. Let me get this information in my hands. So we sent him a book down into Texas. So it's kind of cool. It's allowing me to expand my reach. This information is critical for anybody that you know and love dealing with health problems. Specifically tonight, we're talking about blood sugar regulation issues. Blood sugar regulation is a huge crisis, specifically here in Eastern North Carolina. And I know everybody's still freaking out with the whole virus situation that's going on. And tonight, for those of you who stick around, we're not gonna be here for an hour. We're gonna be really quick. I talk fast. But for those of you who stick around to the end, I'm going to give you 2 superfoods that you can eat. The report just came out, shows you eat these 2 superfoods, you are less likely to get infected with this COVID. It's pretty cool. And it's 2 foods that I eat all the time and I love. If anybody knows what those 2 foods are, type it in the comments right now. If you know one of them, guess. Take a guess. That's cool. I'll tell you those for those folks who stick around. Now, most folks, when they think of blood sugar, you think of, what's the first word that comes to your head? Diabetes, right? That's a big problem. Diabetes is bad. And especially here in Eastern North Carolina, it was a doctor friend of mine that said that if you could break off Eastern North Carolina, right where Interstate 95 comes down, and everything east of 95 became its own state, we would have the #1 fastest growing population of diabetics, type 2 diabetics. We eat terribly as a society down here in Eastern North Carolina. And secondly, the numbers are probably somewhere around 70% of the American population is classified as overweight or obese. And that's a disaster because that's what leads to health problems. Look at what these, everyone is now familiar with these terms, comorbidities, right? We learned about this stuff back in school a long time ago, but now everybody knows what a comorbidity is because the people who are more likely to die from not just this virus, but from the flu and from pneumonia, the people who are more likely to succumb to an infection are people who have comorbidities. That means other problems. It means they're not healthy. People that are not healthy are more likely to die. That's not rocket science, But we're spending all this time looking for vaccines and drugs and ventilators and hospital beds, and nobody's taking the time to say, hey, do these things to make yourself healthier. And that's what we're going to spend a few minutes talking about tonight. If you do these things to make yourself healthier, yes, you're probably much less likely to catch this infection, much less likely to die from this infection. But it's really about getting healthy. See, we're not trying to cure people here in my office. We're trying to make people healthier. And that's it. A good buddy of mine, Dr. Joe, is probably watching right now. He had a nice post that he put up there. It's, look, we're not curing people from autoimmune disease. But wouldn't it be nice to live your life as if you didn't even know you had the autoimmune disease? He's making people healthier. And he's doing a bang-up job down in Wilmington, and I'm trying to do the same up here in Greenville. Follow our directions. You will become healthier. It was a nice girl that came in tonight, and Alicia saw her. In the past 2 months, she's dropped 25 pounds. You think she's healthier? Enormously healthier. You know, and that's way cool. It's stuff like this that excites me. But blood sugar is the topic for the evening. Many people think of the blood sugar as, you know, oh, if I eat a candy bar, that's bad. Yes, it's definitely bad. But did you know that you eat a piece of white bread or even whole wheat bread? What does that turn into? Sugar. And you know, I've railed on this topic for so long that it's blood sugar regulation is your issue. You want to have a constant, steady supply of blood sugar, as constant and steady as you can throughout the course of the whole day. You don't want your blood sugar going up and down, up and down, up and down. And that's a disaster on so many different levels. The first thing that comes to mind is your brain. Your brain needs a constant, steady supply of glucose, blood sugar. When it doesn't get that, that's when areas in your brain start to freak out. The first thing is your brain screams at your adrenal glands, and your adrenal glands kick out cortisol. And cortisol is necessary under times of extreme stress, but not 3 times a day. You know, I had a nice young guy come in yesterday, and he's eating once or twice a day. That's terrible. He can't do that. So his blood sugar is tanking, and his brain screams to the adrenals. The adrenals kick out cortisol, and cortisol jacks his blood sugar up 2 or 3 times a day when he tanks. And when that happens over and over and over, cortisol just does bad things. It has a negative impact on the function of your hippocampus. It starts to fry your brain. Cortisol actually makes your pain worse. So, you know, if you're dealing with chronic pain, it's worse every time cortisol gets jacked up. Cortisol actually makes you gain weight, typically right around here. Alicia was talking about that tonight. Visceral fat. Cortisol does that. Cortisol is a bad mamma jamma. So if you can regulate your blood sugar, your cortisol levels don't get jacked up. And then what goes along with that is cortisol is actually like anti-insulin. It leads to insulin resistance. And insulin resistance is what eventually leads to diabetes. It leads to type 2 diabetes. It leads to inflammation. It leads to leptin resistance. Leptin is a hormone that's produced that says, okay, I'm full, I don't need to eat anymore. And when you become resistant to leptin, you just keep scarfing, and it's just a self-fulfilling prophecy. So if you can modulate your blood sugar, then you're going to get less of that cortisol being jacked up. It's going to lower your inflammation. It's going to lower, it's going to increase your sensitivity to insulin, which is a good thing. And it's going to lead to more sensitivity to leptin, receptors for leptin. So you say, oh, I'm full, I don't need to keep eating. When you eat, even if it's, you know, whole grain bread, bowl of pasta, whatever it might be, that gets turned into sugar, and then your body will in turn release insulin. And insulin will do the job to, you know, make sure that the glucose will get into the cells where it's needed. However, when insulin levels keep going high because you're eating large amounts of these refined carbohydrates, whether it's a bowl of M&Ms or a big sub from the local sub shop, it's blood sugar. Whether it's one or the other doesn't matter. Your body doesn't like it when it gets jacked up, so you got to pump out a bunch of insulin. And just like cortisol, insulin is needed, but it's a bad mamma jamma. It's a mean hormone. And it's got negative impacts inside your body. One of the things that we see with that, when insulin just keeps getting jacked up, is it's got negative impact. It's got a negative impact on your nervous system. We see this so bad in some folks that are dealing with like diabetes, type 2 diabetes, insulin resistance, that they develop neuropathy. And there's a whole classification of neuropathy specifically for these folks: diabetic neuropathy, diabetic retinopathy, also due to insulin. So you want to make sure you're eating to keep your insulin levels down. Blood sugar also has negative impacts on your hormones, on your neurotransmitters. So when you're living with these blood sugar surges and insulin surges, it activates enzymes inside guys Well, in guys and girls, it suppresses, the cortisol will suppress your LH, your luteinizing hormone. So in men, that leads to low testosterone. In women, it leads to low progesterone. So if you are now developing symptoms of low testosterone because you're not regulating your blood sugar, and you go to your family doctor and say, hey, I got all these signs, you know, I'm having a hard time with all these things. They say, oh, we'll just take some testosterone. And so you start rubbing testosterone on. You know what that does? It creates like testosterone resistance. Your receptors shut down. You make your problem even worse because you didn't fix the underlying issue. In our office, we're not trying to cure erectile dysfunction. We're trying to make people healthier. And many times when people get healthier, they can start, with their doctor's blessing, start getting off of drugs. Like, you don't need that stuff. So, you know, if you can just eat properly to regulate the blood sugar, that has an enormous impact on all of these things. You know, the rate of cancer would be halved. You know, making up a number. Heart disease, diabetes for sure, hormone problems, weight loss resistance, obesity, all of these things would improve dramatically if you regulate your blood sugar. So if you eat the way I tell you to eat, you become an enormously healthier person. And we have people that walk into our office that have multiple things. They have diabetes, they're overweight, they've got chronic migraine headaches, they were diagnosed with fibromyalgia, and they're on 8 different drugs. I'm not curing their diseases. I'm making them healthy. So, you know, like I said, if you or someone you know and love are dealing with these issues, chronic pain and inflammation and, energy's in the tank because your blood sugar's going wonky. Heart disease, hormone problems, obesity, cancer, all of these things related to blood sugar problems. You have to call us. I will walk you through the process. We have folks regularly who change their diet and wind up getting off of medications with their doctor's blessing. I can't take anyone off of medication. I don't want to be responsible. I want to get people to be so much healthier that they don't need the medications. Go back to your doctor, work it out with them. I've got another patient who's doing so well. She's cutting Lyrica out of her life. She's down, you know, she's taking 2 less Lyrica every day. And as the Lyrica is a nasty drug, it takes a long time to wean yourself off of that. But she's doing great. She's doing so much better. She's taking 2 less every day and feeling better than she was when she was taking all of these things. That's what gets me excited. So that's why we want to share this information with everyone. Last thing is, if you, if you follow the dietary issues, we also run the food test, and we talked about that last time too. The food test helps us to customize the diet. So generally speaking, we'll put people on a low glycemic, anti-inflammatory, autoimmune type diet. But when we do the food test, a simple finger prick blood test, and we mail those kits out all over the place. I'm mailing another one up to Michigan tomorrow. When we're able to customize the diet to you specifically, when we get the results of the food test back, your results improve exponentially. Right? So, I greatly recommend you do that. And that's simple. I'll put the link up for that one too. I didn't write it up on the board. It's PITT Food Test. PITT foodtest.com. Our book that I showed you, it's book.drrobmccarthy.com. I'll throw that link up again too. And then our coaching counseling programs, www.drrobmccarthy.com. And then our last bonus for those of you that stuck around. Did anybody type in the comments what food it was?
No, I've been watching.
Don't
Well,
guess.
they were watching, but
Nobody wanted to guess on that one, all right? 2 things, and I get so excited about this. Kimchi and sauerkraut. Kimchi and sauerkraut. So I'm going to expand upon that and tell you fermented foods. When you eat fermented foods, It's feeding the good bacteria in your intestines. If you can fix what's going on inside your intestines, you can fix a whole lot of health problems. Kimchi, sauerkraut. I had a patient once whose mother-in-law made her homemade kimchi. Used to bury it in buckets in the backyard. That's like a Korean food. She used to bring me some. I used to die for. Sauerkraut, I could eat it every day. Alicia makes it for me probably a couple times a month. So good. But there's other ones too. If you have any questions about what some other foods are, fermented foods and whatever, feel free, type it in the comment section here. As always, we offer our free 15-minute consultation. We can do that if you're far away. We can do it on the telephone. We can do it by Skype or Zoom. We have a specific HIPAA-compliant one that we utilize, or telephone. Whatever's easiest. You can come in if you're close by. Call our office. I'm here to help. I want to help you. Thank you. God bless you.